purposes of questioning the witnesses.
Madam Chair, thank you so much for holding this hearing. I really always learn things from these hearings, and particularly today I've learned, and I just have to say that I hadn't thought about it, but Dr. Burgess's point is very appropriate, and that is that with the high cost of the consequences of not providing the insulin or not being able to get the insulin, amputations are expensive, the physical therapy that follows an amputation is expensive, loss of vision or even a diminution in your ability to see is expensive, and all of the third-party payers are going to pay a lot more. It's fascinating. Anyway, I have concerns about PBMs, pharmacy benefit managers, and the consolidation in that industry with 3 major PBMs controlling most of the market. Dr. Cephalou, in your testimony, you discussed PBMs and how they have substantial market power and how their PBM's primary customers are health plans and employers and not patients. How has the substantial market power of PBMs changed, if at all, the list price and net prices of insulin? And I know we've already touched on some of this, but let's get it on the record.
Well, the PBMs play a role in the insulin supply chain through their negotiations through manufacturers for the rebates, but their primary customers are the health plan and the insurers, where they negotiate to lower total drug cost and they design formularies. What is not clear is whether those negotiations that take place, and I think some of the comments today were that they are opaque transactions. We don't know whether those transactions are actually benefiting the patient at the point of sale. There's information that we would need before we say how you would improve that system, and that gets back to the transparency.
And so, when we have questions, Ms. Marchand Aprigliano said earlier she had speculations as to where the money was going and so forth. We just don't know when we're dealing with the manufacturers and the PBMs and the insurance companies. It's really hard to follow the bouncing ball, and we had a hearing on that last year that dealt with how do we figure that all out. So I assume that everybody would be in favor of transparency, so we can see what's going on and whether or not the rebates that are being offered to the PBMs are actually increased by a request by the PBMs to the manufacturers to increase their list price. Is that correct?
One of the key things identified was the working group that increased transparency is key to understanding and designing long-term solutions. It's key. We do not understand the negotiations that occur with each entity in the supply chain, and until we do, we won't have the long-term solutions. And that was a key determination, a key finding from the working group. We just do not understand the flow of money through the supply chain.
So at this point, you don't know whether the PBM's use of their market power has benefited or hurt patients, because you don't know what they're doing, because it's all behind closed doors, so to speak.
The working group observation is that it was not clear that these negotiations actually benefit the patient at the point of sale.
Ms. Marchand Aprigliano, in your opinion, why do you think the PBMs have so much power in the insulin supply chain?
So I think that PBMs have power over the entire prescription drug supply chain. And PBMs started with the best of intentions, just like much of anything else. This was supposed to help patients save on the cost of their prescription drugs. But over the course of several years, this has changed to how much profit a PBM can make. And through the rebating system and a way to not share with the patient at the point of sale, we are subsidizing those of us with chronic illnesses are subsidizing the entire healthcare system,
including the net profits of the insurance companies, the PBMs, and the manufacturers?
Everyone in the insulin supply chain. We realize that nobody is out to get us,
right,
and that no one wants to kill us. But there's no profit if no one can purchase a vial of insulin, and broke patients can't buy insulin. So somebody is making a profit, and it's not the patients.
Yes, ma'am. Madam Chair, I appreciate you continuing our look into this, and we'll do this over the next year, I know. And I look forward to participating in that, and thank you very much, and yield back.
Thank you so much. We're going to do it over the next week. But however, it's not going to take us a year to legislate.
Well, that's
Okay?
good news.
Yeah.
Thank you, Madam Chair.
Chair is now pleased to recognize